Oh, I didn't tell her. I'll tell her. All right, so let's get going on today's lecture. We'll go, let's see, what time is it? It's probably close to 10.
Is this PowerPoint alarm?
Uh-huh, yes.
What is it called?
It's called, I think it's called Patient Care and Law.
Oh, okay.
Patients' Bill of Rights is now called AHA.
All right, so as you can see, like we're gonna go through this materials pretty quickly. I mean, I think this presentation is almost 200 slides, so I'm not gonna be hitting on every single slide that's in here. A lot of the presentations are pretty lengthy just because of the content that we need to cover. So I'll lecture for, let's say about 45 minutes. I'll give you guys a 15-minute break and then we'll come back and finish up the day. So again, this content that I'm going over is from your very first course, 1010, which was Introduction to Patient Care. Introduction to Patient Care and Radiology. So we're going to talk about, pretty much just spend some time reviewing some of the laws that are important for healthcare, what's vital signs, different medical equipment that we use with the patients, how to move patients appropriately, let's see, patient immobilization, the proper way to do that, restraints. That's the stuff that we're looking for in here, in this content. So we're going to start off with going over some of the legal aspects. So a reminder of the patient's Bill of Rights. This is where it is a law, and it's basically guaranteeing the patient their information and fair treatment. So remember, in healthcare, we can't deny anybody any treatment or care based off of their condition, based off of their ability to pay, based off of them having insurance. We have to treat everybody as they come in. And there's a specific law within the Bill of Rights that pertains to that. Does anybody remember or know what it's called?
HIPAA.
Not HIPAA. HIPAA is just specifically with patient privacy and protecting their health information. But we're coming up on that next.
What's the question?
What's the specific law that protects patients and guarantees that they have the right to be treated regardless of what they're... EMTALA.
What is it?
EMTALA. It's an acronym. It's like EMTALA.
All I know is if you reject people from any hospital that is in total violation, they gotta pay a lot of money.
Let me see. I don't know if I have it here.
Except the VA.
Does anybody have their textbook? I don't think I have it specifically in the PowerPoint, but it should be in your 1010 text. But it's called EMTALA. Oh, here's one. Here's one. I'm just curious to see what's in here. I'm gonna put it up on the screen. So that's what it's called. So when we say EMTALA, that's just the acronym for it over here, EMTALA, but this is what it stands for, the Emergency Medical Treatment and Labor Act. All right. So the next important law that we want to touch on, which I think Jasmine was starting to say, is HIPAA. All right. So we all know HIPAA, not only just from our personal lives, but we know that we have to abide by this law with our patient interactions. And basically, it's patient guaranteeing their privacy being protected with any health information. All right. So we have to be mindful of that when we're interacting with our patients, because we don't want to accidentally be in an elevator talking about a patient that we were just caring for, and then someone else over here, that patient's potential condition or diagnosis, even just something as simple as going to pick up your patient, okay? You want to be mindful when you're asking that individual for their name to verify themselves or date of birth. You want to, do it with a little bit of, not be really loud with it so other individuals can hear, because that can technically violate HIPAA. Some things that patients have in their control are things such as informed consents, living wills. So all of these documents is what patients typically will fill out when they come into the healthcare facility, especially hospitals. Do not resuscitate, also known as DNR. That's another big one that we need to be mindful of, because if a patient, we go to the units a lot to do a lot of chest x-rays, abdomen x-rays. If we have a patient that we're doing a portable exam on and they have an order for DNR, and you're doing a chest x-ray, you notice they're not breathing, you want to be aware of that, because you don't want to go in there providing CPR if they're a DNR patient. All right, so it's really important to kind of be mindful of those things. What they form,
Do they put that somewhere? How would you know?
usually they have it on the door. Just like if a patient was in isolation, that's another area in patient care that we'll get to, but the different isolation standards that patients have, typically that is on their door or on their chart. It should be somewhere to where you can see it. And usually it'll just have the abbreviation like you're seeing here, DNR. Uh-huh. You need towels?
Like a paper towel and napkin.
Oh, is there any on that cart? Any napkins or anything on that cart?
Oh, yeah.
Yeah.
Thank you.
So with patients and informed consent, again, this is the patient's right to refuse any procedure or treatment. So if we have a patient that's coming to our imaging area, we have a barium enema ordered, and we're bringing them in, we're explaining to the patient, and the patient says they don't want to do it. Can we still make the patient do that exam?
No.
No, right? Okay, so a patient has the right to refuse any procedure or treatment, and what would you do in that situation?
Documented.
Correct, so you're gonna document what took place, all right, but we cannot force the patient to do anything that they do not want to do. All right, in order for a consent to be deemed valid, the patient must be in a good mental capacity, they have to be competent, and they also have to be of age, all right? So they have to be 18 years or older. If that individual is underage, then the consent will need to be completed by their guardian or their parent. But the main thing is that you want that patient to be mentally competent, to understand what is going on, what they might have to potentially have with various procedures, surgeries, and also understanding the various risks involved. The consent also must be voluntary. We cannot force upon any individual to complete these consents. Now, we know we encounter all various types of patients, so there are potential barriers to obtaining these informed consents, and these are some examples. One main one is primarily language. If we know all of our forms are going to be in English, but if that individual does not understand English very well, or that's not their primary language, you may need to have somebody translate that form. Or there may be forms, depending on what healthcare entity you have, that are primarily in Spanish, since that's another popular language here in the U.S. So you may want to provide them the consent form in that language. Or if you don't have one readily available that's already translated, have an individual come and translate for them. Also, intimidation. We talked about intimidation primarily with pediatric patients and some ways that those individuals might feel intimidated. So you never want to come off as being abrasive or aggressive. You just want to state the facts, be reassuring, and make sure that the patient is fully understanding of what's going on. Also, put things in non-medical terms. You guys have been in the program for a while. You've been in the clinical environments for a while, so you guys are very familiar with a lot of the medical terms and jargon. Your patients are not going to be, so you have to remember that. So you may need to break things down to them in non-medical terms to where they can understand a little bit better. Now, the next few slides, I'm not going to spend a lot of time on because it's just basically legal terms and definitions. All of these are going to be highlighted in your textbook as well at the beginning of the chapters. I think, if I'm remembering correctly, I think like the ethics and legal stuff is towards the end of your textbook, like chapter 23, 24, somewhere around there. So that's where you'll see all of these definitions for the various legal terms. So just go back through and familiarize yourself with them.
How many were on the first one? I'm just trying to get my bullet points together so I do it.
Go back.
Yeah, one please.
And I'm sorry, I was sick like the beginning of December. It went away, I got better, I was on meds, and like the stupid cough just came back like last week. But I don't have COVID, it's nothing like that, it's just a stupid cough. So sorry if I have to keep coughing here and there.
Okay.
Good?
Thank you.
So again, there's, all of these terms are going to be in your textbook, so you can just go through and review the definitions of the various criminal law terms. And I think this might be the last one. All right, so two terms that I am gonna go over just to see if you guys remember is, and I think one of these for sure was on your test, so we'll see how good you remember from your test questions. But there was two legal terms in Latin that we wanted you guys to be familiar with. One is res ispa liquidator, so do you guys remember what that is?
Is that the thing that goes for itself?
Uh-huh, yes, so that's the thing speaks for itself. And the other one is respondent superior.
Master, something about the master.
Mm-hmm. So here's what I'm talking about. So those are those two terms that you guys want to be familiar with as far as the legal component. So we have respondent superior, where it's referring to let the master answer. And the other one is res ispa liquidator, which is the thing speaks for itself. All right, so moving on to ethics. What is our governing, or tell me some of our governing entities that drive our ethical component in our profession?
ARST.
So we have the ART, which is the American Registry for Radiologic Technologists. So they have a huge ethical component. You guys as students are to abide by those same ethics, even though you're students, and obviously when you graduate and you're working in the profession. That's why when you come into the program, we talk to you guys about any potential legal aspects, any legal ethical issues, because at the end of the day, when you guys apply to the ART later on the semester around March, they're gonna do an extensive background check, and if anything comes up, that may prevent you from taking the registry board exam. We don't have control over that. We can say that you're a great student, you've met all the requirements, you're done with the program, you're on track for graduation. But if they do their search and they have issues that come up, they could deny you sitting for that board exam. So there are a lot of ethical components. What's another professional society that has ethics that we abide by?
You mean just radiology or the whole health?
No, for radiologists.
What was the question?
So we got the ART already. So,
SRT.
so the ASRT. So JCERT more so is a governing entity for accreditation for our program. So they implement various standards and objectives and data that we have to maintain. But the other one that's heavily involved with ethics is the ASRT, okay? And they are the American Society for Radiologic Technologists. So you could actually, I don't know if you guys remember, you could actually join ASRT as a student, and you can continue to be a member once you get into the profession. It's up to you. The nice thing about the ASRT, I'm a member of it. I wasn't always a member of it because I just felt like, oh, that's just another thing to make your money type of thing. But I did become a member a few years ago. And the nice thing about the ASRT is once you guys graduate and you're working in the profession and you're RTs, do you guys know you have to maintain CEs or continuing education?
Yeah.
So you have to maintain that every year in order for your license to remain active. And the rule of thumb is that you have to complete 12 continuing education credits every year. All right? So there's a lot of variety ways that you can do that. You could go to conferences, some of the larger healthcare institutions like Piedmont, Wellstar, they may offer different training or classes that you might be able to get one CE from. But with ASRT, the nice thing is that they always offer you CEs to complete throughout the year.
Is it included in the price you've already paid?
Yes, so I think the membership is like $140 for the year, and you have up to 18 credits that you can complete every year. The minimum that's required by the ART is 12, but they give you an opportunity to complete up to 18 if you choose to.
Do they roll over? Yeah.
No.
Oh my God, you do 12 a year.
You always have to do a minimum of 12 a year. So, they offer those.
And when you do through ASRT, they automatically record for you.
So,
They offer it automatically upload into the system, or do you have to take it in your job and upload it manually?
you have to do it. You're talking about uploading it to ASRT?
Well, like, okay, so when you do the continuing education credits, where do you have to upload it to?
If you're in a hospital setting, they have like, you have that learning system, they have things that offer you credit and automatically goes.
So it automatically goes
It gives you
to the national database.
Well, make sure, it might vary depending, so, because that would need to be reported to the ART, because they're the ones that are gonna check it. Because when you renew your ART every 2 years, they're looking at you've done 12 credits each year, and they want that documentation. So if it doesn't automatically go, you do have the opportunity to download it, but you just wanna make sure you have access to that information. Either say in a PDF, say in a copy of the certificate, and then you can just
I
update it.
want to say the certificates are usually yours, but it's taken like for a while or whatever.
Yeah.
I think they
Sure
should
if it automatically goes to it.
Yeah, I don't know about that. This is random. Our CPR certification expires in May. Do we get another opportunity to renew it before we graduate?
Typically we don't.
Yes.
Yep.
Because typically we only do it one time a year in October.
Yeah, how much would it be though?
The $10 a month?
As, but the last time we did it in October was, yeah.
Yeah, I might.
Actually, no, I think it went up to, well,
I'm about to say.
Oh, it's okay.
We do that.
But I have a book
Well, we can
already.
still use the same book we had to buy, correct?
We can use the same book, right?
yeah, just as long as it's after 2020, because that's the last time they did changes.
Yeah.
So I can talk to Ms. Wallace to see if we can,
I read mine outside, so I usually do mine outside.
Can't beat $10 for $12.
Yeah, I can.
yeah.
And then I'm just come here every year.
Yeah, we'll just come every year.
It'll be like a reunion. It'll be like our class reunion that we get.
But I know some employers do offer it for free, but everybody's just like really getting tight with funding, so I don't even know if they're doing that. I've worked
I have,
with
they do,
employers.
they most employers do, but it's a BLS and it's a AS, you know, AS, and yes, they're different.
Mhm.
So you can have both, but some companies buy this. So I can different.
Now Jasmine, with the ASRT, if you guys decide to be members with the ASRT, and I'm not being an advocate for the ASRT, I think I'm a spokesperson right now, I'm just letting you know all the stuff. But, you'll have access to the credits through them, and they have various, means of offering to get the CEs with them. Like every month they have like a live 1 hour, session on something, and it's virtual, so you can just sit there. I mean, sometimes I just have it going in the background and I'm like relaxed and I just have it going and I'm like, okay, I got one CE, okay, that was easy. They also have like, readings that you could do and do a post quiz. So there's different opportunities that you can do, but they will track it and keep record of it and they will automatically send it to the ART. So when you go to do your ART renewal, it'll automatically be pre-filled in. So it's just an option. But you wanna make sure that you're abiding by the ethical values. If you're not sure what they are, you can go to the ASRT, you can go to ART, and they have the list of all of their ethical values listed there. But pretty much just don't get, I mean, you all know right from wrong, you know what you should and shouldn't be doing, but just don't get caught up in anything that you know is not right. You wanna make sure that you're always putting the patient care and health and well-being first and foremost, because that's why we're in this profession and why we're doing what we're doing. Because we're here to treat and, help patients that are coming in that need the various procedures and experience performed. It's very easily to get caught up in doing things, I mean, I'm sure, I haven't really actually heard of any instances here in Georgia, but I know in Florida kind of Miami, they're kind of like, got a lot of shadiness going on there. But, you know, I've worked at hospitals where patients have, gotten things stolen from them, their wallets, their personal belongings in the hospital. I've had an MRI tech that was, because, you know, patients can't go in with their belongings in MRI because it'll strip everything. If you go in there with your credit cards, it's gonna demagnetize that card. So we've had a MRI technologist that was stealing patients' cards and using it, all kinds of craziness. So all of that stuff will eventually get reported back to these agencies, and you can actually lose your license over it. So you definitely don't want to get caught up in anything like that.
Article or something had like, the person had passed away and the nurse was like buying vending machine food with their card.
Yeah. So just be mindful that you're always abiding by the ethics, staying legal, not getting yourselves caught up in anything as you continue on in this profession. Who remembers Alara?
As low as reasonable achievable.
So as low as a reasonably achievable. Make sure, and Ms. Wallace, you know, is gonna spend some time with you guys on radiation protection and safety. So we're still teaching, Alara, we're still teaching shielding to help abide by Alara, to minimize the exposure to our patients. But we know that shielding practice has really changed and is kind of no longer a thing in the clinical environment. So just kind of keep up to speed on that as things continue to change, through legislature and stuff like that. It's still a part of our curriculum. The ART has not made any changes in regards to that, so that's why we're still implementing it in our programs and in our instructions, but it's important for you as professionals to keep up with any potential changes once you're out in the work field. Communication is essential, not only with our patients, but we work alongside other healthcare individuals. We work with nurses, we work with radiologists, we work with ER physicians, so we want to make sure that our communication is where it needs to be. So I know that some of you guys came into the program and you're really shy and timid. So we kind of have seen you guys all come out of your shells and you're more boisterous and advocates in your role as students and with your patients. So you want to make sure you can continue that. If you feel like something doesn't make sense, definitely question it. We know there's medical errors that occur all the time. So you don't want to just go along with the flow. Make sure that if your patient came down for a procedure and they're not quite tolerating it well, that you communicate that information to the patient's nurse before they go back to the floor. Do you guys recall what that the four-letter acronym is that we use for handoff communication? Not
Oh, it's S-bar.
Yeah, S-bar, okay. So S-bar, let me see if I have a slide on that in here. I don't have a slide on it, but it's definitely in your textbook. It's S-bar, S-B-A-R. It stands for situation, background, acknowledgement. I can't remember what the R is. You guys don't have to look that up. Can't remember the R offhand, but it's definitely in your textbook. But that is a form of handoff communication that you want to do with your patients.
What was the
SB,
situation? What?
situation, background, I think it's acknowledgement, and I can't remember the R.
Repeat, maybe?
Read response.
I don't know.
Situation, background, assessment, recommendation.
Okay.
Recommendation.
Thank you, Jasmine.
I'm just giving.
That's why you're in the blah club.
All right, so make sure that the communication is accurate and timely, and also documentation is really important. So not only just physically documenting on any paperwork, anything that may have transpired, but also going through the appropriate systems and documenting electronically. We all have to document contrast that was given to our patients, right? We gotta enter that lot number, what type of contrast medium was administered, the expiration date. So make sure all of that information is being reported. Communication with the patient's family members and visitors. Be careful with that because again, we don't want to violate any patient privacy information. So if you do have to communicate anything specific to those individuals, if your patient is alert and responsive, make sure that you get the consent and get the permission from the patient. Hey, I see your family member is here. Is it okay if I'm able to communicate your personal health information in front of your family, in front of your visitors? Don't just make that assumption. You guys mentioned AIDIT, okay? So AIDIT is more so a tool that we use for effective customer service and communication with our patients, all right? So that stands for acknowledge, introduce, duration. You want to let them know how much time they're going to be with you, explaining what's going to take place or the procedure, and then thanking them at the end. So I know for sure Wellstar uses this methodology, Piedmont, a lot of entities use this as a good customer practice, customer service interaction with their not only their patients, but they also do it with the patients' family members and visitors as well.
Is the, oh,
You said the E was explained.
Uh-huh.
Sorry, Mr. Mayor, quick question, Ms. Wallace is still gonna, be here when we leave? Cause I just need to know if I need to hurry up. and give her
Today?
this attendance sheet.
Oh, yeah, she'll be here, cause the class next door ends the same time we do, so yeah. Now, some examples, we also have different types of communication. We have verbal and nonverbal, okay? So give me some examples of verbal communication.
Speaking language.
yes.
So spoken words, even written words is a
Words.
form of verbal communication. What about nonverbal communication?
Gestures, smile.
Gestures.
Right, so body language,
Mhm.
eye contact, any potential gestures. So here's a list of some examples of verbal communication. And then for our nonverbal, again, making that eye contact, any type of gestures, body language, being able to physically touch an individual. So those are some examples of nonverbal communication. So you want to be able to identify the differences between the two.
How is personal hygiene?
Have you
Smell.
stank?
It is.
Well, I'm asking like, how would, like, what does that mean?
It changes someone's perception.
Yeah,
Like, oh, you stink. Okay.
Yeah.
Yes.
yeah, that's a
Yeah.
non-verbal right there. They
Yeah.
smell you and they gonna be like,
Or like, even like with your, for example, like your diabetic patients,
Excuse
like
me.
if they have like a foot wound or something that hasn't been taken care of and it's starting to get, infected or gangrenous, that's gonna have a really impactful smell, and they may not realize it, but you're gonna walk in and when they take their shoe off for that foot x-ray, you're like, oh. So,
They know.
They know.
all right, so what are some things that we need to keep in mind with our terminally ill patients? What type of issues are those patients experiencing?
they probably in a coma. They might be, mentally,
Like in regards of them getting an x-ray, what precautions you should take, or? like,
Yeah,
how
because
you
what are,
treat them?
when we say terminally ill patient, what does that mean?
That could be anything.
they dying.
Yeah, pretty
So
much.
they might not be,
They might
like-
wanna
You still
refuse
wanna
it a lot
communicate with
more.
them.
you still communicate like they conscious, like,
Take
you
your
know.
time, just
Yeah.
still do it.
Right, so you want to keep that in mind because they may be in a different stage as opposed to a regular patient that's just coming in because they fell down. These patients are dealing with a lot more in a sense that they're terminally ill and they know that they've been diagnosed with a terminally ill disease. So that leads to our stages of acceptance and anger because a lot of those patients are dealing with that. So you may not know what stage they're in for that. Because remember there's 5 different stages of anger. So let's take a look at those so you guys can just recall what that entails. All right? And I misspoke, I'm sorry, it's the 5 stages of the grieving process. So with terminally ill patients, we actually encounter those patients quite a bit, especially patients that may have a various form of cancer or metastatic disease because they're going to be coming to the imaging department a lot for either routine checkups or routine x-rays to track the progress of the tumor, if their radiation or chemotherapy is working to shrink that tumor, if they're getting a port put in for chemotherapy treatment. So we see them quite a bit, all right? So often these individuals will have a lot of family and visitors with them, so we wanna take that into consideration. Their family might be a little bit more of a spokesperson for them, depending on if they are able to relate with us or interact with us, because some of them might be unconscious. They may be going through different treatments to where they're not in the mental capacity to speak with one of us. So basically, just be aware of these individuals and the grieving process. So as I mentioned, there's 5 steps of the grieving process. So you could encounter these terminally ill patients at any point of these 5 stages of the grieving process. So you want to be aware of them, because if you have a patient and they're just super angry, okay, and they're just giving you attitude and they don't, want to be there, they're like, why do I have to do this? They might be in that anger stage of the grieving process because they may have just been diagnosed 2 weeks ago. All right, so you want to be familiar with the 5 different stages, because it's not something personal towards you. They're just going through this grieving process because of their terminally ill disease. So it's important to be familiar with those 5 different stages. All right, so the next area, I'm gonna take a break. Let's take a 10-minute break here. The next area that we're heading into is like body mechanics, patient transfers, movement. Remember we had you guys do those lab exercises on each other, transferring each other from the stretcher to the table, wheelchair, so we're kind of go over that and recap that information. And then we'll get into some general equipment and popular equipment that you'll see with our patients on a regular basis. And then I think we should be able to get into a little bit about trauma and emergency care and some situations that we'll encounter with those emergent individuals. So let's take a 10-minute break. It's 10:35, so let's come back at 10:45. All right?
Oh, and then I'm taking up way my ass with it, and then I'm starting
Okay. Alright, y'all, so I can't get through this semester unless I sell some shirts or something, so I'm selling shirts and stuff, okay? I ain't trying to rob y'all, I just need some gas money.
we need to have some classes.
It's from my house. I am so upset that I've been driving the furthest from my house, senior citizen.
Where do you are?
Sweatshirts, whatever you need, just.
Yes.
What's up? I can put whatever you want. 'cause I
No,
know
we're gonna have
I didn't even know we
we're
went
gonna
there.
make
It's
it.
because she just told me to go.
No, it's.
Yeah, no, we're gonna talk about it,
Okay.
and then we're gonna make plans.
But I'm
I thought,
Yeah, let's all
This
have
is
a plan.
just-
I thought Fayette
yeah,
was
so it's called-
closer than me than Griffin.
No,
it's not.
Fayette's where Griffin people usually go to work.
First of all, I drove past Tanger to get there yesterday, and I was just like,
I just want to that all of our clinic sites are within 32 miles of the school.
Absolutely.
Griffin is far as fuck, and Griffin is easily 20-something miles from me, and I'm in Stockbridge.
it's literally like 31 miles away from me.
Okay,
Because Ellen was starting. And yesterday, I was like, I'm so excited because I was like, yes, I don't have to go until 8.
No, I wouldn't, but I'm working on a sweatshirt now, but I'm just trying to put.
But see, that's the stuff that bothers me, because everything's supposed to be 32 miles from the school. And I'm all home.
It's a little shaky.
Working on that now, but I ain't finished yet.
It's a little shaky now.
Oh, wait, what? That's right, you're actually free outpatient.
You're gonna. You met,
So the tech yesterday, we did this patient, but she verified the information, right? So she was like, how old do you think that lady
You
was?
said, you
And
said
I was
never
just
walk
like,
by
I
yourself
don't know,
all day long.
early
That
seventies,
piece of
late
all.
sixties, so she was like, no,
You
she's
sit there and
49,
all
but she,
day like
that's
that.
her, what,
It's so
seventies,
fun. I
is
go
what she looks
sleep,
like. There's a
take a
Griffin age,
I've
and then
done
there's a
all of it.
regular age, and I was like, not a Griffin. She's like, you're gonna see this a
Yeah.
lot, so
You
when
know,
I
I was
refer to
telling
people like this, I say, their actual age is 39, but their Griffin age is 70.
Griffin is a, like, I don't know, it's like a dark place. Every time I've ever driven through there, I'm like,
It's a little,
like
You
you,
know, probably let you do it.
it's not,
It's,
It's more.
it just
They were
reminds me of like
It's
a
like
rundown
people
McDonald's
like
square.
you know, it's like.
I don't know how to describe it.
Downtown. That's what I would call it.
Oh, okay. It's like, you can obviously tell there's not a lot of things to do out
And
there.
they're really cool.
Just drugs. That's what
Yeah,
they all
yeah,
do.
yeah.
They don't care.
That's
But,
rough.
I mean, but like I said,
I drove out for the sock shop and it was not even good. I thought they had good deals.
I mean, the workers there are really, really nice.
That was black wasted my gas.
Yeah, they don't practice Alara at all. I'm just saying that. There is no such thing as Alara. Portables and computer stations.
People still ask, people actually still ask for your service.
And then I be sitting there like, damn, you encounter more radiation setting outside than you do here. So shut the hell up. And what they
Oh,
ask.
I'm so like tired of groceries.
Oh, by the way, the X-ray outpatient broke like 3 times while I was there after the person came to fix it twice.
Just as good, this is new cellular?
Yeah. I was like, yo, what the heck? They're like, oh, just shut off and turn back on and then we'll, take this in. I was like, where am I? I was like,
Oh, so she said you somewhere crazy, huh?
I mean, like I said, the techs there are really, really nice, but they're all on their third husband.
Third husband?
What you say? That was the first conversation. Mind you, these people are not that much older than me. So because it's not really busy. So they all just complained about how their like third husband's girlfriend was like messaging them, like 3 of them. And I was like,
Wow, that's.
How does everybody have a like husband with a girlfriend?
I was like, and they're like, girl, don't mind us. This is what we talk about in the morning. And I
This
was like,
heater
I
won't come
am
on.
intrigued.
Spill the tea.
That's
I
all.
love hearing random people's stories
Me
like
too.
that, where like I don't even know anybody, but I'm
The fact that
all
you're
invested.
all
Like, oh my god.
Under like 40 and had multiple husbands is very amazing.
She's still
That's right. How you
recording.
Wait back. How was it?
She's still recording.
Oh, sorry, big dog. It's cold in here. Lauren, where you at?
Where am I
Yeah.
at? Resurgence in Marietta.
Where are you?
The VA.
Oh, have fun.
Yeah, I'm on the evening shift. It's okay.
Oh, no, that's better.
Yeah, the evening shift is
that's
okay.
better.
How about you? We went,
I'm at Resurgence, Decatur.
how's that one? The bar for there?
It's the first.
That's the place where you clock in from your phone, right?
Yeah.
Yeah, I need that place.
Oh.
Yeah.
I asked them to let me use their computer, but if we're allowed to use our phone.
They told me, I asked them it because like
And Rockdale, what's up with that? You can't punch in, like, I don't
They told me
I already
that
told you, it's
we're
a
not allowed.
whole, what I used to do for Rockland is I used to go into the ER,
I
clock in,
waited
and
till I
then
walked
just
all the way out to my
drive
car.
all the way to the door. Because it's impossible.
Oh,
If I
I don't,
wait to
I
get
just
to
don't
the
wanna
court
get
clock
short
in, I was
either.
late
Yeah.
every single
I
time.
don't even.
Oh,
So
okay.
I just go in, I let the
I was short.
registration lady buzz me in, and then I just go into the,
Show hours, only like 5 hours.
the little radiology, one
So
of them
they
is
just
out
give you
here.
clinical assignment, pick it up.
Okay.
Yeah.
Okay.
You know how many hours I worked over there? I had so much to say.
Yeah, Griffin, they
I had
were
no idea.
they were literally doing portable chairs and chairs like this in the middle of the hallway with people.
Warm up?
And I was just like, this is very doable, I'm sure. Like, I'm talking about like a hallway like this chair in the middle of the hallway, people walk behind it and they're just shooting chest.
I'm pretty sure.
And then somebody stole that chair, so got a rolling chair, and then the patients were like,
That's why I asked
sitting in a
about it.
rolling chair. Well, I'm sitting there, back against the
Yeah.
board, and I was just sitting here like, somebody's gonna fall.
Or
This is
will be
why,
glad,
this
yeah.
is, why
That's
can't,
just like waiting for.
I'm like, why can't we just bring
So
them
many
into the
violations.
room? Like, we can bring away our patients into a room and do chest X-rays. It's just really crazy. But I was like, I'm not trying to say anything.
I think a lot of people like, I don't know, I feel like the quality of service is like really shitty. It's like, and like nobody cares. It's like I went to get my nails done, like my toes done, and my sister, she was like, get your nails done. I was like, I'm not supposed to have it done, so I'm not gonna go get my nails done now. So I told myself I was gonna do it like all for it and then after it's on.
Yeah.
And I was like, cause you used to not be able to have nails at all in like a hospital setting or a restaurant, cause it's like not sanitary. And now it's like, you can have whatever, nobody even cares.
But they have to, yeah, I just was like, people say you're out there, like, we get questions, what do I got?
Definitely a transport.
Does your surgeons make you wear a mask?
What they were
Yeah, I was like, this is the first time I've tried to make a
Well, I wore it in, and then like everybody else was like not wearing one, so I just put it in.
I wore mine in the day they were like, oh yeah, you have to wear that. Like, it's okay if you do, but you don't have to.
Yeah, they didn't tell me like anything. I just noticed nobody else had one on, so I didn't.
It depends, it's like, when I went in yesterday, people were coughing, they were like, I never wear this, I was like, my school says I have to, like, I think y'all know what you do, it's like, y'all coughing on the face.
Yeah, I mean, these other surgeons do it, there's not gonna be clear.
Yeah, it's like outpatient.
Yeah, it's very much outpatient, knee replacement stuff.
Yeah.
Yeah.
Patients.
You're not one down to outpatient.
Yeah.
Oh, it's just allergies.
You're
Like, I know, whatever your body's trying to expel, I don't want it. So,
Or outpatient.
It's alright.
It was
alright.
we had a bunch of people though. Did you guys see there was like
I mean, it was,
And then I worked with,
It was like,
AFC Mains
I
there.
wouldn't say brunch, like it's not like a
Whenever
hospital
you
shift,
are.
but it was steady.
no, I mean like cause we had like the two ladies that were like working, and then the manager, I guess she just came back, but she can't work. She's just like doing admin stuff.
There was just two.
Yeah, there was like 3 plus me, and it was like a very small area.
There's two, and they told me on Wednesdays, they each work half the day, and then on Thursdays, there's like.
It is. I was like, this is clock to go.
They only have, it depends on how many providers they have there.
Cherry.
What'd you say?
I'm gonna be over here studying and I'll just go and sit.
I did an oral or I was supposed to go.
They said they liked you.
No, he did.
I was like, yeah, that's part of my class.
I have back at different jail.